Which of the following mammalian cells is unable to aerobically metabolize glucose to carbon dioxide? A. Liver cells. B. RBC. C. Untreated muscle cells. D. WBC. A 40-year-old Vietnamese man who arrived in Darwin 6 weeks prior presents with 5 days of headache, fever, and malaise. What is the most likely diagnosis? A. Malaria. B. Typhoid fever. C. Dengue fever. A 21-year-old man walks into your surgery with his head tilted sideways, his eyes rolled up, and his tongue sticking out. He speaks with difficulty but says that he has been stuck in this position since taking a new medicine a few hours ago for his nerves. You should administer A. Diazepam. B. Benztropine. Coral is 55 years old. Her period ceased 8 years ago. She now presents with vaginal itch, discharge, and soreness. The most likely cause is A. Candida infection. B. Vaginal atrophy. C. Vaginal dermatosis. Which of the following is incorrect? A. The incidence of hemochromatosis in Australia is 1:200. B. C282Y homozygotes account for more than 90% of hemochromatosis in Australia. C. 90% of C282Y homozygotes develop symptoms of the disorder at some stage in their lives. A 22-year-old Melanie presents with a 2-day history of vaginal discharge, urinary frequency, and dyspareunia. Which organism is the most likely cause of this presentation? A. Gardnerella. B. HIV. C. Chlamydia trachomatis. The interossei of the hand are supplied by A. The radial nerve. B. The median nerve. C. The ulnar nerve. D. All of the above. A 55-year-old woman presents with an itchy purple papular rash on her wrist. She is not on any medications. This is most likely to be A. Lichen planus. B. Lichen simplex chronicus. C. Lichenoid eruption. A 21-year-old female patient presents with lower abdominal pain and tenderness at 14 weeks of gestation. Her temperature is 38.5 degrees Celsius. The most important diagnosis to exclude is A. Pyelonephritis. B. Threatened abortion. C. Appendicitis. A 42-year-old man presents with a recurrent severe hemicranial nocturnal headache which lasts for 60 minutes and occurs regularly every 3 weeks. The headache is accompanied by a blocked nose and a watering eye. The most likely diagnosis is A. Chronic paroxysmal hemicrania. B. Cluster headache. Which of the following may be a good reason for stopping breastfeeding? A. Inverted nipples. B. Cracked nipples. C. Engorged breasts. D. Breast abscess. A 40-year-old physician has had muscle twitching for 1 year. The twitching occurs predominantly in the lower extremities. A neurological and general physical examination is negative except for these twitchings. What is the most likely diagnosis? A. Benign fasciculations. B. Hypoparathyroidism. Which of the following is of least value in assessing the level of active joint inflammation, disease activity, in rheumatoid arthritis? A. Duration of morning stiffness. B. Presence of tiredness, malaise, and weight loss. C. Presence of rheumatoid factor in the blood. In a couple trying to conceive, intercourse should take place. A. As soon as there is a rise in basal temperature. B. 14 days after the onset of the next period. C. On alternate days before the basal temperature rise. D. On alternate days after the basal temperature rise. Sudden onset of unilateral orbital pain, photophobia, lacrimation, and blepharospasm suggests a diagnosis of A. Open-angle glaucoma. B. Anterior uveitis. C. Temporal arteritis. D. Unilateral blepharitis. A patient presents with acute gout but has a low serum uric acid. Which of the following drugs can be responsible for a low serum uric acid? A. Colchicine. B. Prednisolone. C. Indomethacin. The benign jaundice that occasionally occurs in the third trimester of pregnancy is most closely related to A. Decreased circulating amounts of albumin to bind bilirubin. B. A specific defect in glucuronide conjugation. C. An autoimmune process. D. High estrogen and progesterone levels. Accommodation of the eyes to near objects is accompanied by A. Loss of binocular vision. B. Constriction of the pupils. C. Divergence of the visual axis. D. Relaxation of the ciliary muscles. The serum phosphate is most likely to be low in which of the following disorders? A. Osteoporosis. B. Osteomalacia. C. Multiple myeloma. D. Polymyalgia rheumatica. Which of the following is not true regarding asymptomatic bacteriuria in pregnant women? A. The incidence is 3 to 7% of all pregnancies. B. Defined arbitrarily as greater than 100,000 bacteria ml. C. Responds to a short course of oral antibiotics. Which finding in this report of cerebrospinal fluid, CSF, examination is inconsistent with the other results? A. Elevated protein. B. Normal chloride. C. Elevated glucose. D. No red cells. About Tietze syndrome, which of the following statements is incorrect? Tietze syndrome is A. Painful, tender swelling of one or more costochondral joints. B. The cause of up to 30% of chest pain presentations to emergency departments. C. Sometimes associated with the development of rheumatoid arthritis later in life. A mother develops a fever of 38.2 degrees Celsius 3 days after the delivery of her baby. Which of the following is the most likely cause? A. Endometritis. B. Dehydration. C. Breast engorgement. In which spinal cord segments are the motor neurons responsible for the knee jerk located? A. L1, L2. B. L2, L3. C. L3, L4. D. L4, L5. In which of the following conditions of the colon is malignant change most likely to occur? A. Adenomatous polyp. B. Melanosis coli. C. Diverticulitis. D. Familial polyposis coli. A 32-year-old man with ankylosing spondylitis presents to you for management of his disease. Which of the following clinical features is he least likely to complain about? A. Sudden development of dull lower back pain. B. Attacks of pain and photophobia in one eye. C. General malaise, fatigue, and weight loss. In men less than 35 years of age, the most common causative organism in epididymitis is A. Mumps virus. B. Escherichia coli. C. Chlamydia trachomatis. D. Neisseria gonorrhoeae. The most likely venous source of fatal pulmonary embolism is A. Iliofemoral. B. Subclavian. C. Saphenous. D. Pelvic. A patient with moderate to severe emphysema would demonstrate all of the following physical signs except A. Distant heart sounds. B. A prominent pulmonary second sound. C. A narrow intercostal angle. D. Prolonged expiration. In trigeminal neuralgia, all of the following statements are true except A. It is most common in middle-aged and elderly persons. B. Multiple sclerosis must be considered in younger people. C. There is an associated weakness in the muscles of mastication. Peter presents with a painful left eye associated with a sudden loss of vision. Which of the following conditions is not usually associated with pain in or around the eye? A. Amaurosis fugax. B. Retrobulbar neuritis. C. Acute angle closure glaucoma. A 62-year-old housewife presents because of pain in her left cheek precipitated by eating or touching her face just under the left eye. This pain lasts for 30 to 60 seconds. The patient is most likely to benefit from A. Dental attention. B. Penicillin. C. Carbamazepine. The most important muscle used for inspiration is A. External intercostals. B. Diaphragm. C. Scalenes. D. Rectus abdominis. Complications of a major burn include all of the following except A. Fluid loss. B. Myocardial depression. C. Myoglobinuria. D. Increased immunocompetence. The most common cause of intellectual disability in Australian children is A. Birth hypoxia. B. Down syndrome. C. Intrauterine growth retardation. D. Fragile X syndrome. With regard to children in Australia who are infected with HIV, all of the following are true except A. Annual influenza vaccination is advisable. B. IPV is preferred to OPV. C. They require BCG vaccination if the environmental risk is high. Which of the following is least likely to be associated with increasing the risk of squamous cell carcinoma of the esophagus? A. Achalasia. B. Alcohol ingestion. C. Plummer-Vinson syndrome. Causes of preterm labor include all of the following except A. Cervical incompetence. B. Oligohydramnios. C. Multiple pregnancy. D. Pregnancy-induced hypertension. A 6-week-old baby with a 36-hour history of projectile vomiting is at risk of which of the following electrolyte and acid-base disturbances? A. Hypochloremic metabolic acidosis. B. Hypokalemic metabolic acidosis. C. Hypochloremic metabolic alkalosis. Retroperitoneal fibrosis commonly presents as A. Ureteric obstruction. B. Bilateral leg lymphedema. C. Bilateral thigh claudication. D. Testicular pain. Regarding suspected appendicitis in late pregnancy, which of the following is true? A. It is the most prevalent extrauterine indication for laparotomy. B. Pregnancy increases the risk of appendicitis. C. The fetus is placed at extra risk by laparotomy, so management should include extended observations. When assessing a patient in emergency with suspected diabetic ketoacidosis, which of the following is not true? A. Ketoacidosis may occur with infection only in the presence of fever. B. Nausea and vomiting are common presentations. C. Abdominal pain can be so severe as to suggest an acute surgical abdomen. Which of the following statements concerning secondary dysmenorrhea is true? A. It usually affects women in the older age groups. B. The pain is due to the release of high levels of endometrial prostaglandins. C. Nausea, diarrhea, or constipation are a common associated symptom. The most common fracture to occur in a baby during birth is A. Humerus. B. Femur. C. Clavicle. D. Pelvic. Secondary amenorrhea in adolescents can be due to all of the following except A. Anorexia nervosa. B. Hypothalamic pituitary disorders. C. Pregnancy. D. oral contraceptive pill. From birth to 4 years of age, the most likely setting for childhood injury is A. Home. B. Child care center. C. Motor vehicle. D. Community recreational venues. Jenny is 32 years old and requires a splenectomy for idiopathic thrombocytopenic purpura. The most important factor in preoperative preparation is A. Cross-matching enough blood. B. Provision of pneumococcal, meningococcal, and HIB vaccination. C. Assessment of bone marrow function. All of the following are non-metastatic extrapulmonary manifestations of bronchial carcinoma except A. Nephrotic syndrome. B. Finger clubbing. C. Hypertrophic pulmonary osteoarthropathy. D. SIAD.